Hello friends, the topic of today's discussion is therapeutic drug monitoring. Whenever we decide the dose for a drug, as you go in the market, you can see that a drug or any formulation, it has some fixed amount of that substance in or the drug in that dosage. For example, say paracetamol, it comes in 500 milligrams. So that dose is decided on the basis of this finding that that dose will be sufficient in most of the patients. It will be tolerated, well tolerated, and it will be effective in a, a maximum amount of people. But in some cases, what happens is the drug may show a therapeutic failure in some individual, or it may show toxicity at the same dose, which may be safe and effective for most of the population. So that is one consideration, and the thing which might have changed in that may be the variables of pharmacokinetics or some pharmacodynamic variables. They may have changed, some concomitant disease, many factors which influence this thing. So therapeutic drug monitoring is a process of individualization of the um, drug dosage, or you can say the it is a process in which we individualize the dose for a particular individual. So it is a, you can say, a very time consuming process and a very costly process, so it is not required in most of the cases. Okay, the thing what we do here is we take a sample of, we can take a plasma or we can take blood. Okay, and what we do from here, we calculate the concentration of the drug. Okay, so we calculate the concentration, and for calculating this concentration we might need some specialized equipment like say HPLC, chromatography. Like HPLC is one type of chromatography. So such type of process might be required for using for undergoing this process, therapeutic drug monitoring. Okay, so why we need this? It is not required in most of the cases. For example, um, in case of drugs where the effect can be seen right in front of your eyes. Say for example, if I am giving antihypertensive, if I am using an antihypertensive on a patient, and I can very simply check the BP, and I can see whether the drug is effective or not. So in those cases it will not be required. Or if I am giving a drug which has got a very wide safety margin, so I know that even a little overdose or a little overdose will not be toxic to the patient. So in those cases I would not require a therapeutic drug monitoring. It would be a cumbersome, and it would be a wastage of money. But in cases where the safety margin is low, so one indication for therapeutic drug monitoring is a, you can say, it is a low safety margin. Say for example, drugs like digoxin. So digoxin has a very narrow safety margin. So means a small increment in the dose may lead to toxicity, and if the dose goes below a certain level, it may lead to therapeutic failure. So in those drugs where the safety margin is narrow, we need to have a therapeutic drug monitoring. Okay, digoxin. Then another drug is theophylline in this case. So for such drugs having a very narrow therapeutic margin, you might have to use therapeutic drug monitoring. Okay, then if you are using a drug which is being used for a prophylactic purpose, say for example anti-epileptics. Now anti-epileptics, the you do not know, because they are preventing epilepsy. So how can you measure, or how can you come to a conclusion that they are effective? So we cannot calculate that. So in that case, what we have to do is, we have to again go for a therapeutic drug monitoring. Okay. Then, to check for compliance of the patient. Now compliance is what? Compliance is whether the patient is adhering to the regimen which we have asked him. Say for example, we have asked the patient to take 500 milligram of a tablet twice a day, and the patient is not taking the medicine, or he is taking it only once a day. So what do you expect? The levels which we expect that would have reached in that patient, they will not be there. So we can check for the compliance also. Okay. So low safety margin, anti-epileptics, compliance, and where the therapeutic effect cannot be ascertained. For example, as I told you about antihypertensive, you can just see the effect, but you cannot say whether the effect is happening or not happening. So in that case, just as the case with anti-epileptics, you cannot quantify the effect actually. So in that case also, again, you just go by the therapeutic drug monitoring. Okay. Or when you need to know about some antibiotics may require this monitoring for to know, because there are antibiotics which have actions, what we call as, there are two types of actions of them. One is what we call as a time dependent killing, a time dependent killing, and another is a concentration dependent killing. So means a time dependent killing, for example, say a drug is, one drug is vancomycin. So vancomycin, for vancomycin, what we need is the levels of the drug should be more than what we call as MIC, or the minimum inhibitory concentration. They should be always, they should be more than this throughout the time, when as long as we are giving the medicine. If it goes below the MIC, it will not be effective. And the concentration dependent killing is seen in drugs like aminoglycosides. So in case of aminoglycosides, what we see is uh, the drug levels, they are allowed to peak first. So you can see a peak, and then they are allowed to go down in between doses. So the next dose may be here, and say for example, this is the minimum inhibitory concentration. The drug levels, if they go beyond this and stay there for some time and then go low, there is no problem in case of aminoglycoside. So these drugs, for these drugs again, we can use therapeutic drug monitoring just to see where do they fall, whether they are hitting the MIC or not. So there are many uses for this therapeutic drug monitoring. Now what we actually do is, we know that we equate the plasma concentration is equated, or you can say it is related or linked to the effect or the therapeutic effect. Okay. So we know that at a particular plasma concentration, a particular effect will be seen. Fine. So in most of these cases, I have told you that we cannot ascertain the effect, but we know that this particular plasma concentration should give this effect. So when you are hitting that plasma concentration, obviously you can assure that the drug will be effective. So this is a purpose of this therapeutic drug monitoring. Okay. So now there is one important thing, and there is one concept what we call as a steady state. There is a concept called as a steady state concentration. Okay. So steady state concentration is when the rate of administration equals the rate of elimination. Okay, so when we give a drug to begin with, what happens is, say I am giving a drug orally, so it's this the concentration of the drug will rise and then it will fall. Okay, simple. This is the part when absorption is occurring, and then this is the part when elimination is occurring. Okay, so this is a general pattern which is followed by a single dose of a drug given orally. Okay, so what happens is, when we give another dose before this drug being eliminated completely, what happens is there is a cumulative effect. So now the next peak will be somewhere over here. Okay, and then we give another dose before it's falling down, there will be another peak a little higher, and then again, and then again. So what we see after 4 or 5 half-lives, this state is reached, which is, this is what we call as a steady state. And in this steady state, what has happened as of now, in the earlier doses, what was happening, you know, the rate of elimination, there are drugs which follow the first order kinetics, and there the rate of elimination is directly proportional to the concentration of the drug. Okay, so means as the concentration increases, the elimination also increases. Okay, so to begin with, when the concentration was less, the rate of elimination was also less. Okay, and as the concentration kept on increasing and increasing, the rate of elimination also started picking up, and at one point these two became equal, and that is when we reach the steady state concentration. And now you can see that in this steady state concentration, what is happening, there is undulation, or you can say just like a sine wave pattern is found, because this is the place when a drug is given, so the concentration is rising, and after some time the drug is eliminated and the concentration falls here, and then again next dose is given. So the every next dose is just given to compensate for the losses of the elimination. Right, got this? So this is what is happening in the steady state. Now this steady state concentration is what we like to be. It should be the therapeutic concentration. Okay, means this concentration should be the one which should be effective. Okay, so say there is one concentration which has been defined, which we know that for a drug which we are giving, any dose above this or any concentration above this concentration will be effective. And then there is another one which we could call as, for this concentration, you can call it for the toxic concentration. So it should stay between these two. This, if I say this is the therapeutic concentration, this is the toxic concentration, the steady state concentration should lie in between these two. Getting it? So now the more is the gap between these two, if the difference between the therapeutic and the toxic concentration is high, there is a great possibility that your steady state concentration will lie in this, and the drug will be free of any side effects. Okay, or at least only permissible side effects will be there. Got it? And what happens if this margin is less? Say the margin, now I draw another margin, this say if the therapeutic and the toxic concentrations are somewhat like this. This is the toxic concentration that I am drawing, and this is the therapeutic concentration. So what you can see that at this steady state, when we give the drug, it might go beyond the toxic concentration. Okay, and during this trough, it might go below the therapeutic concentration. Fine. Getting my point? So whenever the concentration is, whenever we give the drug, we expect the concentration to go up, and it might just cross the toxic limit. And when it goes down, it might just go below the therapeutic concentration. So it may lead to toxicity, and it may also lead to therapeutic failure, depending upon uh, what is happening. Actually, now if, say, if the toxic concentration is on a higher side, or the therapeutic concentration is more on the lower side, this problem will not be faced. Now you can predict the point of showing all this is when to take the sample, or the timing of the sample. Okay, the first thing about timing is it should be taken after the steady state has reached, because that is our target concentration actually. If we take a sample here, it will obviously below the therapeutic concentration, so there is no point of taking a sample here. But we can take it for modifying further doses. If we take it after 2 half lives, say here, if we take a sample here, we can predict where will the steady state lie. Okay, so then we can adjust the doses. If we are going very fast, we might half the dose. Okay, so that is one way of doing it, but generally it is taken when the steady state has already reached, means after 4 or 5 half lives. Okay, and now whenever we are concerned about toxicity, whenever we are concerned about toxicity, we have to take we have to take the sample here when it is in its peak. Okay, so that means in the midway between the two doses. Okay, midway, or you can say a little time after giving the dose. Okay, a little time after giving the dose, you will be finding a sample which will be adequate, or which will be appropriate to tell you whether the drug is showing toxicity or not. Okay, and whenever it is, whenever you are about to give the next dose, means here in the bottom of this, then if you take the sample here, it will tell you about the therapeutic failure. I hope it is simple, or I hope it can be understand. I hope you are getting what I am going to tell you. Therapeutic failure, for assessing therapeutic failure, you will have to take a sample just below the administration of the next dose. Okay, and if you are concerned about the toxicity, you will have to take a sample when it is in the upper side, or you can say when it is when the crest is there, and in the trough phase you have to go for the therapeutic failure. I hope that is that is clear, and that is all about therapeutic drug monitoring. I hope I have made this topic clear, and please go through your books, and you will have a better understanding, and you will find better examples of many drugs which we use, which we put to therapeutic drug monitoring. Thank you so much.